I can't tell you how many patients come in, and when we look at their med list, biotin is one of them. And it may seem harmless, but the problem with biotin is that it interferes with certain laboratory tests. And if someone's taking biotin when those bloods are drawn, it can actually miss a heart attack.
Welcome to Health Matters, your weekly dose of the latest in health and wellness from New York-Presbyterian. I'm Courtney Allison. These days, it seems like everyone has a take on the ideal skincare routine. So rather than listen to an influencer or a celebrity, we decided to ask one of our experts, what is the right way to care for our skin over time, and what vitamins and products are actually important? This week, we talked to Dr. Shari Lipner, a dermatologist at New York-Presbyterian and Weill Cornell Medicine, who gives us her recommendations for how to take the best possible care of your skin so that it stays healthy. She also addresses some myths about skin and aging. So, Dr. Lipner, thank you so much for joining us today.
It's great to be here, Courtney.
So, what does it mean to take care of your skin? I think to some extent we're all aware of our skin and things like wrinkles. What are some of these proactive measures that could help?
Yeah, it's super confusing these days for people to understand what to do with their skin. There's just so much information out there that it's overwhelming, what to do. And so even though perhaps rubbing a banana peel on someone's skin makes them look good, we want to have a study that actually shows banana peel versus something else makes you look good. And so if there's no study like that, then that's anecdotal evidence. And that's not something we go by. We go by evidence-based medicine.
Right.
So one of the most important things that we can do that's actually quite simple and doesn't take a lot of time is to make a routine out of applying a moisturizer with sunscreen every single morning. And that's not just if you're out swimming or out in the sun by the beach. This is a daily activity because UV rays can damage the skin, cause skin aging, and make you more prone to skin cancer, even in a cloudy day or even in the winter months. So that's one simple thing that each and every one of us can do in the morning as part of our daily routines.
I'm actually very proud of that. Even if I'm staying inside all day, I put sunscreen on.
I mean, that's a great idea because there is some ambient UV rays that can penetrate windows. We know that even if someone is driving in a car, there are UV rays that actually penetrate the windows. And you may not, realize that you'll go outside later in the day, and this way you won't even have to think about it.
So what do you recommend as a proper skin regimen for the average person? What are the basics we should all be doing or avoiding?
Yeah, so, people think it's this complex thing and, they're busy, they have to go to work in the morning, maybe they have to get some kids ready in the morning, and they don't have time for a routine. The good news is to have young and healthy skin, it's actually quite simple. Just like we're used to brushing our teeth every day, we can do a simple skincare routine that fits into the morning and doesn't cause you to be late for work. And so what I recommend is washing your face with a gentle cleanser that's fragrance-free, and then applying a vitamin C serum in the morning, let that dry, and then applying a moisturizer with a sunscreen SPF 30. That's really all you have to do.
What is it about the vitamin C serum that's so good for your skin? Because I feel like there's so many serums out there, you don't always know. And then a dermatologist told me a couple of years ago, the vitamin C serum is the one. What is it about vitamin C?
So there's two features of vitamin C that's helpful for people's skin. One is that it's an antioxidant, so theoretically it can prevent skin aging. And the second thing is it is a blocker of the UV rays. So both of those things will help you look and feel younger.
I did not know that, but I have noticed a little bit of a difference with that. So that is good to know. So we've covered how listeners can take care of their skin in the morning. Do you have any best practices for how to care for skin at night?
Now, the nighttime routine is a little bit different than the morning time routine. It starts off with washing the face with a gentle cleanser to get off those oils, bacteria, dirt, makeup, anything that people may apply during the day. But then for those patients that are not pregnant or intending to become pregnant, it's a good idea to apply a retinoid at night. Again, there's not a ton of data on prevention of skin aging, but probably applying retinoids is the best thing that you can do for your skin. There's actually evidence that it can help fade some of those subtle wrinkles, those fine lines. And so it's a really, really useful thing to do in the nighttime. Now, retinol is an over-the-counter retinoid, and topical retinoids are prescription medicines that are derived from vitamin A. So they're actually derived from vitamins, and they can help exfoliate the skin. They can help eliminate some of those skin lines. They also have acne-fighting capabilities. So if you're prone to acne, that's kind of a double whammy for you. The only negative about retinoids is that they can be drying, especially people with skin that is already dry or people that have eczema or rosacea. And so for application of retinoids, I recommend consulting with a board-certified dermatologist to really get your regimen that's individualized for you. But in general, what I recommend to my patients is to apply a pea-sized amount of a retinoid and start off with just 3 nights a week with days in between. So a sample regimen would be Monday, Wednesday, and Friday nights. Now, if you're getting dry just from doing that, what you can do is you can dilute it with a little moisturizer. And that's a simple trick that may help you get acclimated to the retinoid.
And so once you put retinoid, should you wait a little bit before putting moisturizer on, or does it not really matter?
Yes, I would recommend letting the retinoid dry before putting on the moisturizer. So usually give it about 5 to 10 minutes.
I know you should always be careful about sunscreen, but I thought I heard if you're using retinoids, you should be extra careful about sunscreen.
So I think there's a lot of misinformation about retinoids.
Mm-hmm.
You know, people think that they shouldn't apply retinoids in the morning because of sunlight. But the reason that as board-certified dermatologists, we recommend applying retinoids at night is because the sunlight inactivates the retinoids. So It's not that it's dangerous.
Okay.
It's just that it won't be effective. And so the best time to apply retinoids is at night to get the best efficacy.
What age would you recommend someone consider using retinoids for skin aging?
Yeah, I think for adults. So I think probably, people who are in their 20s could start using that as part of their routine. But keep in mind that retinoids generally, we don't recommend them in pregnancy. So, the 20s, the 30s, even the 40s is a time where a lot of women start family planning. And so even if it's been part of your routine for many, many years, it's important always to keep in the back of your mind.
I wanted to go back when you mentioned the banana peel. I was just laughing because to your point, there's a lot of myths out there. So I actually genuinely wasn't sure if that is a myth or if you were just making a joke. Is banana peel a myth out there?
So banana peel does have some nutrients in it. It has vitamin C. And so from that standpoint, it could be beneficial to rub it on your face. The problem is that vitamin C in the banana peel, it's not really formulated to penetrate the skin. So if you want to get vitamin C onto your skin, that's probably not the best way to do it. The other thing is, banana peel has other things in it and it could be irritating to your skin, especially for people who have skin conditions such as eczema or psoriasis. So my recommendation is if you want to get vitamin C onto your skin, don't do it by way of a banana peel. A vitamin C serum that's really formulated to penetrate the skin is a better move. And vitamin C use is actually evidence-based. It's not a myth. And so vitamin C has antioxidant properties. And in a serum form, it can help with skin aging and also provide some sun protection. Now, it shouldn't substitute for a sunscreen, but if you use vitamin C in the morning plus a sunscreen, you'll get extra sun protection.
So are there any other common myths that you consistently hear about skin health?
Yeah, there's a lot of myths surrounding skin health because I think that many patients want kind of a quick fix for their skin condition. They want a holistic approach, which, I think is great. But certainly, I think if someone has a skin condition, be it like eczema, psoriasis, etc., we don't know of a way to just use diet or supplements to cure those skin conditions. And perhaps one day we'll have a better understanding of that. But right now, there's not really enough evidence to support diet or supplements for treating skin conditions. Some things that are popular, very popular, is use of a supplement called biotin. And it's even marketed by many of these vitamin companies as a supplement for skin, hair, and nails. And patients just kind of eat that up, that they're taking the supplement for their skin, hair, and nails. I can't tell you how many patients come in, and when we look at their med list, biotin is one of them. And, it may seem harmless. And, I think for a while, I thought it was harmless. But the FDA put out 2 warnings about biotin. And the problem with biotin is that it interferes with certain laboratory tests. And some examples are pregnancy tests, thyroid tests, and troponin tests. And so if someone is having chest pain and we measure cardiac enzymes, those are called troponins. And if someone's taking biotin when those bloods are drawn, it can actually miss a heart attack. And if you're whisked off to the emergency room with chest pain, you won't have time to stop your biotin and your doctor won't know what's going on. So that's one reason not to take biotin. There's actually very little evidence that biotin is beneficial for hair, skin, and nails. So there have been some small studies perhaps showing some benefit, but in general, the patients who did have benefit to their hair were biotin deficient. Most of us get more than enough biotin from our diets. And as for the nail data, the studies that were done showing improvement in brittle nails and nail growth, these studies were tiny. They didn't have any controls. And so we don't know if it really works. So, for all these reasons, I think biotin is likely not helpful for skin, hair, and nails. And there are some dangers to using it. And we have good options for all of these conditions. So it's really best to have a board-certified dermatologist diagnose your condition and have an individualized plan for you.
So going back to the bigger picture, what's the number one thing you might tell a patient who is looking to protect their skin over time?
Yeah, so I think the number one thing to be mindful of is to get into the routine of applying a moisturizer with SPF 30 every morning. That's going to help your skin look and feel good, keep you looking young, and keep you away from getting skin surgery.
Thank you so much for your time, Dr. Lipner. It was so great having you.
It was great to be here, Courtney.
Our many thanks to Dr. Shari Lipner. I'm Courtney Allison. Health Matters is a production of New-York-Presbyterian. The views shared on this podcast solely reflect the expertise and experience of our guests. To learn more about Dr. Lipner's work with patients, check out the show notes. New-York-Presbyterian is here to help you stay amazing at every stage of your life. To get the latest episodes of Health Matters, be sure to follow and subscribe on Apple Podcasts, Spotify, or wherever you get podcasts.